Hello, everybody. Welcome to the Virtual College Exploration Program sponsored by the Illinois Association for College Admission Counseling. This is a great opportunity for you to learn about different opportunities for Illinois students. So to all of my participants, how do you ask a question? Use the Q&A button to type your questions to the presenters at any time. Your camera and your microphone are off, so you're muted, your video's off, we can't see or hear you. So all your communication should be done through that Q&A. Please sign up for more sessions. We've already completed a bunch of sessions. There's a whole lot more sessions to come. And all of those sessions will be recorded, including this one. So after each session, you can go to IACAC.org to explore more sessions. So without further ado, I'm going to turn it over to our colleagues at Lakeview College of Nursing. I'm going to stop sharing my screen so you can. Nija, you are muted.
Sorry about that. I'm Nija Givens. I'm the admissions recruiter here at Lakeview College of Nursing. And we also have Amy McFadden, our coordinator of marketing and recruitment here at Lakeview. Here at Lakeview, all we do is nursing. So we are a standalone nursing program for college juniors and seniors. So what this means is that just like with any other four-year university, you first take your prereqs, your gen eds, those first 2 years, but then you would actually transfer to us for your majors. So our students earn their Bachelor's of Science in Nursing and their RN license. So they can come from a community college, another accredited four-year university, or they can actually be working RNs or LPNs and then transfer into our program. Our pass rate for first-time Nclex takers is 88%, and the Nclex is actually the licensing test that our registered nurses take before they can actually become a registered nurse. About 91% of all of our qualified applicants do receive admission into our program. We have two campuses. One is in Danville, Illinois, which is about 2.5 hours from Chicago, and our second campus is in Charleston, Illinois, which is about 2 hours from St. Louis. Because we have two campuses, traditionally we don't have to have a huge wait list for our students that want to attend our program. Both campuses offer the same nursing curriculum. We have really cool skills labs, which you can see in the background of Amy's screen is actually our skills lab. So anything that can happen in real life, we can mimic it with our simulators. So we have adult simulators, pediatric simulators, and even a birthing simulator. So it's really cool. We encourage you to either take our virtual tour, or if you're in the area, take a look at our campus. Our campus is open, so come with your mask and we would be happy to have you. We do offer small lecture classes, small labs, small clinical sizes. Our ratio for students for clinicals is about 1:8. And this is really helpful in COVID times. We do follow all CDC and state guidelines for social distancing. So when quarantine happened, our students were able to actually work online, but then when it opened back up, our students are in person. So that is a huge question that we get asked a lot. Our students are here, they're taking classes, and they're going to medical facilities in the area for those clinicals. Next, I have a video that shows why several of our students chose Lakeview.
Be a nurse. Choose Lakeview College of Nursing.
I chose Lakeview College of Nursing because they have an excellent reputation.
I wanted my bachelor's degree in nursing.
I love the practical experience that I get with my education.
I chose Lakeview for the individualized classroom attention.
I can live at home and save money.
I know I'm getting a great education from outstanding faculty.
I chose Lakeview for the wide variety of clinical experiences that are offered.
My veterans benefits made it very affordable.
Be a nurse. Choose Lakeview College of Nursing.
The great thing about earning your Bachelor's of Sciences Nursing is that our students, once they've went through the program, once they've got their RN license and that BSN, they can be flexible in the field of nursing. So they can work in hospitals, they can work in medical offices, they could be traveling nurses. So there's a lot of things that Amy will talk about later that you can actually do with nursing. As far as getting into our program starts after you finish your first 2 years of college. So we're not gonna look at your high school GPA or your SATs. You're gonna go and take your first 60 credit hours at either, like I said, a community college or another 4-year, and you'll take those prerequisite courses. So like your anatomy and your physiology, things like that. Our students do have to have a 2.5 coming into the program, and also they take an entrance exam called the HESI. So that's going to test them over all those prerequisite courses, their gen eds, and things like that. So what's really cool about our program is that we work with you to make sure that you're ready to apply. So after you complete those prereqs and your gen eds, you'll work with us and we'll make sure that you have the right GPA, you've taken those right courses. This is a list of the prereqs that are required. So our prospective students have to take English Composition 1 and 2, Speech, Anatomy and Physiology 1 and 2, Chemistry 1, Chemistry 2, which is an inorganic and an organic chemistry, microbiology, statistics, a behavioral science course like psychology, a social science course like sociology, lifespan and human growth, humanities class, a fine arts class, and then a second humanities or fine arts, because our students are getting their bachelor's degree. So this is a little bit more than what you would do at a community college to just get your RN. You're working towards that bachelor's of science degree. You also have to take 2 3-credit-hour electives, nutrition, and medical terminology. So if you're looking about and thinking about going into the nursing field, take some of those science courses early. If your high school offers dual enrollment or AP credits, those are things that can help you meet some of those prereqs so that you can be a little ahead of the curve when you start taking your courses at a community college. Next, we have a video for one of our students, and she'll tell you a little bit about her experience at Lakeview and how she got into the nursing field and why she wanted to be a nurse.
Hey, I'm Hope. So I'm going to talk a little bit about nursing and what brought me into the field of nursing. I had another career before I started this. I was working in a pharmacy. I worked with patients every day, and I decided that I wanted to do things a little bit more hands-on with patients. So I have gotten that experience here with clinicals. You meet your patients, you work as a nurse. So I'm actually getting a feel for what nursing is and what it can be like in real life because I'm doing it. And it's really kind of solidified for me that this was the right decision. When I thought about going into nursing, I knew that I loved working with people. I knew that I wanted to help people and wanted to be very hands-on in that regard. So some things that helped me kind of lead onto that path were really, if you like A&P, you're going to use that every day. If you enjoy microbiology, you're going to use that every day. If you like psychology, you're going to use that every day. So it kind of combines all of these things. And in addition to the math and the chemistry and some things that you may or may not like, chemistry was not my personal favorite, but it has helped me in my nursing career. So you are going to use those things on the job, kind of all in combined all together, and you will learn to help patients with those concepts. And there are so many directions that you can go with nursing. You can go into an office if you choose to do that. You can work in a clinic. You can work in a hospital, an ER, or an ICU. There's just any direction that you want to go with it. There's a place if you decide that nursing is for you.
Okay, well, as Hope said, everybody kind of has their own journey into nursing. The cool thing is you can match almost any interest that you have with a nursing career. So everything from teaching to psychology to community health to computers. There's a field of nursing that involves all of these things and so much more. You can work with different age groups of people. So everything from OB and pediatrics to geriatrics. You can work in many different environments, as Nigel mentioned earlier, everything from hospitals to clinics to home health to businesses and corporations. You can also work in different specialties, such as cardiology, oncology, women's health, many, many, many others. So there's nursing informatics, there's neonatal nurses, flight trauma nurses, rehabilitation nurses, nurse practitioners, nurse midwives, nurse anesthetists. it really gives you about the most flexibility of any career, because you can do so many different things with it. So I'd like to challenge you and ask where you see yourself. Maybe you have other interests that you could match up with a nursing career as well. And we obviously are always needing nurse faculty members, so that's also something to think about. So I'll be curious where you see yourself. There are many, many jobs in the profession. It's the largest healthcare occupation with more than 3 million jobs. And one of the occupations projected with the most growth. You did also see the salary range there, which also is a nice bonus if you're, drawn to nursing because you want to help others. It's also nice to know that the salary is there for you as well too. I mentioned several different areas of nursing. Thought this might be interesting as well. I don't know if y'all are familiar with Nurse Blake, but he's kind of famous on YouTube. So we're going to give him a couple minutes to tell you a little bit more in depth about a couple areas of nursing.
What's up, guys? I'm Nurse Blake and welcome to my channel. In this video, I'm going to share with you the different nursing opportunities beyond the bedside. So there are so many different jobs out there for nurses. And a lot of times when we think about nursing and nursing jobs, we think about hospital jobs at the bedside. These are typically 3 12-hour shifts. But if bedside nursing is not for you, and that's okay, there are plenty of other options. Now, there's so many great opportunities that I'm not going to be able to cover every single one of them. So if there's something I didn't mention, make sure you drop that in the comments below and let us know what that job is so other people can learn about it. Number 1, case management. These are nurses who act as social workers. So they do participate in the patient experience from admission to discharge. And really they're connecting the patient with outside resources. They're communicating with the healthcare team on the discharge plan, and they're really the facilitator. This is mostly a job in the hospital, but you can also find this job in the community-based setting as well. So clinical case manager is such a great experience because you still get to work with patients and be a part of the healthcare team. Next, we have research nurses. This is such a cool job. I know many of my friends have been research nurses and they love it. So they help the physician and patients work together on clinical trials. So they're asking patients questionnaires, they're researching different medications and procedures and reporting on it. So if you're interested in research, and if you were one of those kids in nursing school, you love the research component, research nurse may be a good fit for you. So check it out. School nurses.
Okay, so that kind of gives you an idea from Nurse Blake. If you'd like to see more on that, you just search for Nurse Jobs Beyond Bedside on YouTube. The wonderful thing about our nursing program is it's designed to give you insight into several different areas of nursing. So you'll see that we cover everything from the foundational levels of nursing into health assessment, pathophysiology, pharmacology. There's adult health nursing. There's, we call it mental and behavioral health, which is your psych nursing component. There's maternal and newborn care, which is our OB class, as well as infant, child, and adolescent health, which is pediatrics. Older adult health would be your gerontology course, gerontological nursing. Then also moving into population and global health, which is more about health within a community, as well as leadership and management, which really hones in on, how you're going to put everything together within that concept synthesis course that you take within your last semester as well. So it takes you through several different areas. There are lecture, lab, and clinical components built within the curriculum. The wonderful thing is that there are special services available too. So there's tutoring available for all levels of lecture, as well as there are open lab times that are available. So if you need a little extra help with your nursing skills, you can come to the lab that you see in my background here and get a little bit of extra help with the hands-on portion of nursing too. And so there are, many things available to help students continue to be successful while they're here in the program too. So I think that is, something that's definitely worth mentioning as well. Within our lab, we also have high-tech simulators that are basically computerized patients. So those are not the ones you see behind me, but if you decide to join us for a virtual tour at some point, you'll get to see those a little bit closer up, or if you come for a private tour, you could also do that as well. As far as the simulators go, we have different ages of patients. So we have an infant model that's a simulator, as well as a pediatric model, as well as an adult model, and even that birthing simulator that Nigel mentioned earlier. And that is a lot of fun. If you ever see that in action, we actually have students that will play roles to go along with not only the nurse manager and all the different roles of nursing within that simulation lab, but as these computerized mannequins are doing what they need to do, demonstrating different health issues, sometimes with the birthing model, there is no voice like there is on the other simulators. And so the students are actually acting out the voice of the birthing mother. So that's a lot of fun as well. So throughout the program, our faculty can help you get all of the help that you need along the way. They make sure that you get all of the experience that they want you to receive, whether it's with real life patients or with the simulators. We do have a lot of real life situations too. So our students are placed in different clinical sites. Typically they're within a 70-mile radius of the home campus of that particular student. So both campuses usually use clinical sites that are in the Champaign-Urbana area, facilities such as OSF Hospital, Carl Foundation Hospital. There's also an OSF hospital in Danville that's used frequently, as well as Sarah Bush Lincoln that's in Mattoon. So that's a wonderful way to round out both all of the above. So you have lecture, lab, and clinical components that go into this curriculum. You'll see on the bottom that there's 2 tracks that are mentioned. There's a traditional track that typically takes 2 academic years, and the accelerated track that usually takes about 1.5 years to complete. Now, keep in mind, this is after you complete those first 2 years of foundational courses, so the prerequisites and the general education requirements. So things that Nigel mentioned earlier, like your rhetoric 1 and 2, or English composition 1 and 2, your speech, your anatomy and physiology, and all of those courses are done first, whether that be dual enrolled high school credits, or you're doing them at another accredited college or university, and then transferring those credits into Lakeview. And so the starting point here you can see is that semester 5 with us, moving through the rest of the curriculum. So there are 60 credit hours that you would complete in nursing for us. If you decide to do that accelerated track, the way that it differs from the traditional track is that it includes a summer session. So that allows you to complete this coursework in about 16 months or 1.5 years. So it can be a very quick option if that's what you're looking for, or if you want to do it more traditionally, you would take the summer off in between those 2 academic years. So you would do semester 5 and 6, take a summer off, and then do semester 7 and 8. So there's lots and lots of different options. We have a very flexible program in terms of how you can move through it. There's not just one way that you can move through the nursing curriculum. So that's good to know as well. So once you come into the program, or you're getting ready to come into the program, you might want to take into account the finances. And so we'll go to the next slide that will tell us a little bit more about the finances of the college too. We have the cost and financial aid budget listed in the lower right-hand corner there. That's based on the current academic year. Obviously, things might vary a little bit depending on if you're living at home, how far you have to travel, and those types of things. The other thing we wanted to mention is that there are lots of resources available to help with the cost. So there is financial aid available to those who qualify. The first step of the financial aid process for our school, as well as most other colleges and universities, would be completing that free application for federal student aid. So if you are a senior right now, filing opened for the FAFSA, or the free application for federal student aid for all colleges and universities, October 1st. So we really encourage students to take that as the first step in finding out whether or not they might qualify for things like Pell Grants or MAP grants or student loan monies and so forth. So that's a great first step to take. Beyond that, we do have tremendous scholarships involved. We have scholarships that are available to high school students as well as transfer students, as well as our current students. So there's lots to consider there too. The high school scholarships usually are valued up to $4,000. And you would have to meet particular criteria in order to qualify for those. Those were set up by the donor according to their certain regions that you would need to live in to potentially qualify for that. But don't worry if you don't live in those particular regions. The transfer scholarships are available to all of our students, regardless of where they're from. And those have a value up to $20,000 each, based on merit as well as financial need. So there again, the FAFSA that we've talked about earlier is an important step, because that's also something that we would require if you're going to fill out a scholarship application. So it's kind of an all-around good thing to do. So definitely want to fill out that FAFSA first and then start looking into the scholarship process. You'll see that 46% of our students receive scholarships, so that's nearly half. So your odds are pretty good, and even a higher percentage at 84% actually receive some sort of financial aid while they're here enrolled at Lakeview. But yeah, I definitely want to mention yet again, I can't stress enough to please, 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 please take the time to apply for scholarships, because they cannot be awarded unless you apply. And believe it or not, sometimes we, like other schools I've talked with, sometimes have difficulty getting enough people to apply, and there's nothing sadder than having money that you could award students, but if they don't apply, you can't give it to them. So definitely please apply for those scholarships along the way.
And for all of our private scholarships, our students have to take that FAFSA. So even if you don't feel that you would get anything back, make sure you complete the FAFSA. You can also actually put in our school code ahead of time so you can kind of get an idea of what you would be receiving for tuition or things like that from your FAFSA.
Absolutely, that can be very helpful in the budgeting process very early on. We're happy to work with you through all the stages of the process. So we oftentimes are working with students, obviously through their high school careers, as well as on when they enroll in those gen eds and those prerequisites prior to coming in. So whether that's questions about, financial aid and filling out the FAFSA and getting an estimate on what that might be on the monetary side of things and scholarships and so forth, or if it's working through the coursework, we're very happy to help you through all of that process. So if you'd like a closer look at the college, we definitely want to encourage you to maybe consider visiting us. We do have all the protocols in place for COVID, so that's why we're doing only private tours. So that would mean you and perhaps a parent along the way to visit either one of our facilities. So whether that be the Danville or the Charleston or both. Some students like to look at both to get an idea of how they're alike and how they're different. We also are very close to having a virtual tour up and available for you to participate in that option. And we could definitely keep you posted on that following this event, so you'll have more information on that as well too. Or if you would like to schedule a virtual meeting with either Nigel or myself, like I said, we would love to talk to you about any questions that you might have, along the way. In the meantime, we're going to take, I think, a look to see. Okay, here we go. Sorry about that. We wanted to remind you on a final note that all we do is nursing. That is our entire specialty and our entire focus. So if you're looking for a nursing college, we definitely, would fit that bill. If you're looking for a program that's been around for a long time, that's definitely us too. We actually have celebrated recently our over 125 years of nursing education. So we're a well-established program as well. And sometimes that's helpful to know also. You could contact us for more information, or you could certainly visit our website as well. I think at this point we're going to check and see if there might be any questions. I'm not sure if there are or not. Let me take a quick look here.
Yeah, so I answered some questions. And some of you may be asking yourself, okay, I don't live in Illinois, but this is an Illinois school, or I may want to move out of the state. You can actually get licensed in multiple states. So once you're through the program, we'll actually help you make sure that you're fingerprinted, background checks, that you take the right exam for your license. You can get licensed in Illinois, and then you can also have multiple licenses at the same time.
One other thing I want to mention about that too, not that it's the same thing, but for people who may be viewing this from out of state, we do offer the same tuition rate for students regardless of where they live. So it's going to cost every student the same, whether they live down the street from us or if they live, several states over. The tuition and fee rate is the same for all students. Okay, and it sounds like Nigel probably answered any of the other questions that were already there. So we definitely wanted to, just thank you for joining us, encourage you to reach out if there's anything else that we can do for you. We'd love to show you a little bit more of what's behind me, the Nursing Skills Lab and so forth, if given the opportunity to do that. Or if you just have questions about particular nursing careers, maybe there's some guidance we can give you there as well too. Although Nigel and I are not nurses, we're in contact with nurses obviously on a daily basis and usually can use those resources and give good guidance to the nursing career as well too. So thank you so much for joining us. We hope to hear from you in the future, and we'll definitely do our best to keep in touch with you as well. So hopefully we can help you succeed in whatever your goals in nursing are. And I think at this point, if there's anything else Nigel wants to add.
You guys have a great day. Thank you so much for joining us.
Okay. And then we'll go back to.
Well, thank you both for joining us. And to all of our participants, thank you so much for joining us as well. And before we say goodbye to our colleagues from Lakeview, to all of our participants, you don't know how hard it is to present to you without seeing your smiling faces and without getting that direct feedback from you. So right now, whether you're watching live or watching a recorded session, send them some positive vibes because they've reached out to us in a very difficult situation to give this information to us. And I have one quick question for you before we wrap it up. Regarding the FAFSA, if a student is unable to fill out the FAFSA, will you accept the Illinois alternative application for students who may not be able to get licensure in the state of Illinois as a nurse? How would we advise a student who is ineligible for the FAFSA?
I don't think we're able to do that at this time, but we can check with our financial aid office and try to provide more information.
Thank you. I'm sorry to leave you with a real tough question right at the end, Amy. You've done
Yeah, that's okay. That's why we're here.
And to all of our participants, the FAFSA opened on October 1st. So the FAFSA is open. Get on the FAFSA. When this session ends, please stick around for just a quick survey. It'll only take a few moments. Please sign up for more sessions at www.iacac.org. A recording of this session and all sessions will be available. Thank you all for attending.